morning. Yeah, I am Dr. Parin Patel, head and neck surgical oncologist and skull base surgeon in SCG Asta Cancer Center. Today we have the many head and neck cases, almost 7 to 8 major, and we have one of the strongest as well as the largest head and neck team of India. So today I will show you our OR as well as our other rooms, that is the pre-op rooms. I will counsel the patient and will show you how our day in our head and neck surgery goes. And please welcome to our SCG Asta Cancer Center. It is a 200-bedded cancer hospital located in Ahmedabad, and it is one of the largest comprehensive cancer center in Western India. So now I will go and change into the scrub, and we'll meet in the OR pre-op room. Let's meet in the OR pre-op room. So now we are in the pre-op room, and we will meet our two patients who are planned for today. One of them is a big composite resection, another one is a large parapharyngeal mass. First we will meet the patient of composite resection. And now we'll move to another patient. He is a case of a large parapharyngeal mass standing there for very long duration. So I will discuss with him. This is our OT complex. We have the 6 OT this side and 3 OT on the opposite side. So it is one of the state-of-art OT complex, and we have the various trained staff. For this head and neck surgery, we require a teamwork. Without teamwork, it is not possible. So we have the very good trained staff. Also, we have the one of the best of anesthetists in the all over the India. So our main aim is like we should give a best result with less morbidity and good cosmetic. So that is our main aim, and that's why we work in a team. We have the good team of the plastic surgeons also, who provide a good cosmetic as well as reconstruction support. Now we will be starting our first case. That is a composite resection of compartmental ITF clearance, and in that case it will take around the resection part will take around 2 to 2.5 hours, including a neck dissection. And then we'll move on to the large parapharyngeal mass resection. I will also introduce our team inmates, that is OT in charge, with you in a few minutes. He is responsible for maintaining all the staff as well as the tranquility and the maintenance of the OT system. And I hope it all goes well. Meet our OT in charge, Mr. Kalpit, and he is here since last 5 years, and he is managing the OT very well along with the staff and everything. So I will just discuss few things with him regarding the instruments and everything before starting the OT. So whether they are functioning properly or not. So let us discuss. So this is how we planned our surgery. We planned the day before the surgery. All the instruments are checked day before the surgery, and we prepare our instrument before the surgery so that the surgery went smooth. Surgery goes smooth on the next day, and this management is very important, and we have the plenty of staff for that management. And this accurate management plays an important role for the smooth functioning of the OT. So now I will start my surgery. We'll go for scrubbing, and after the scrubbing we'll start a case in few minutes. Let's scrub. Normally we prefer this betadine iodine scrubbing. This betadine iodine scrubbing definitely helps in the reduction of the infection, and we should scrub at least for 2 minutes. The case that we are going to do today, we will discuss inside the OT. the summary of the case and what we are planning for that. And it is a usual for us because we have been doing these cases since last 15 to 20 years. So it is not a big deal for us, but each and every patient is a different. So we have to be very careful regarding this. So this is our OT room. We have a very experienced team of the anesthetists, and these patients are very difficult to intubate. This patient has a severe trismus. Even though with a severe trismus they are able to intubate without tracheostomy or something. So this make our life very easy. So we don't have to do a tracheostomy. And actually we perform around 500 to 600 cases of the microvascular every year. We have the very strong this microvascular team. With this strong team, we are able to perform this much amount of these cases. She is Dr. Mamta, Dr. Sanjeev, and our chief staff. And first we will discuss our case with Dr. Mamta. So she is our senior fellow, Dr. Mamta. Our chief staff, Dr. Peenal, and other chief staff, Mr. Hitesh, and another doctor observer, Dr. Sanjeev from Nepal. So overall, we have the good team, and our anesthetist has already introduced, Dr. Nirjari, and our plastic surgeon will come later on after the excision. Hello, Dr. Kaustubh. How are you, sir?
Hello.
Good morning, sir.
Good morning.
He is Dr. Kaustubh. He is my mentor, friend, and one of the best head and neck cancer surgeon in India. He will provide brief information regarding the robot, the use of robot in head and neck surgery.
So this is the console and these are the robotic arms. And this is one of the most advanced robotic surgery equipment which is known as XI Da Vinci Robo. What happens is that these are the arms of Robo, and these small arms goes inside the mouth or through some other ports go to the neck and operate, so that there is no scar in the neck or there is no scar on the face. Entire cancer is removed through this robotic arms without putting any incision over face or neck. So that is the advantage in head and neck cancer surgery. Not only cancers, the benign tumors of thyroid also this can help. And the surgeon will sit over here on the console. He will move his hand by these are the arms of surgeons which will move these arms into the patient's body. So that is the advantage, that surgeon is sitting away from the patient and the robo arms will go inside the patient and will move according to the surgeon's movement. So this is the biggest advantage for head and neck as well as thyroid tumor patients. And that is what we are doing. We are 7 robotic head and neck surgeons in the team, and we work together as one of the largest team in India for head and neck cancers as well as thyroid disease. The surgeon will sit on the console like this. He will have his head here where he will have a 3-dimensional picture of what is going on inside patient's body by robotic arms. And these arms, these movements will move 360 degree the robotic arm inside the patient. So you are as if I am sitting inside the mouth of the patient and operating. That is the experience which I get from this console, and actually the robotic arms will deliver the cancer out. So that is the biggest advantage.
Hi. Now we'll go to ICU. We will see our ICU patient, and before leaving for a home, we make sure that we always see our post-op ICU patient. Dr. Girish Bhai, he is our ICU registrar, and we will see our ICU patient with him. Hi, now it's around 8 p.m. in the night, and we have finished all our OT. Everything went well. The patient will be shifted to the ICU, and it will be taken care by our anesthetist and all staff. So, and tomorrow again, same routine will start, but tomorrow is an OPD, so we'll start an OPD.